Commissioner Shane Fitzsimmons, the Inaugural Commissioner for Resilience New South Wales, Deputy Secretary Emergency Management with the Department of Premier and Cabinet. You'll remember Shane was the Rural Fire Commissioner during those deadly fires, and he's been awarded the Rural Fire Service Long Service Medal for more than 30 years, the National Medal of Recognition for more than 35 years service, and the Australian Fire Medal. He was the 2021 New South Wales Australian of the Year and the Australian Father of the Year in 2020 through the Shepherd Centre. So please a big welcome to Shane. We're also very thrilled to have with us Christine Morgan, who is the Chief Executive Officer of the National Mental Health Commission. She is a National Suicide Prevention Advisor to the Prime Minister, passionate leader in mental health care reform, committed to listening and responding to the voice and needs of those with lived experience. Prior to that, she was the CEO of the Butterfly Foundation for Eating Disorders and the National Director of Eating Disorders Collaboration. So a big welcome to Christine. So this panel discussion was really designed as a panel discussion with questions at the end, but I think it would be interesting to make it a more interactive session, because I know you're all working in your individual fields with the impacts of the upheaval of the last few years and what that has meant for workplaces. And what we're going to seek to do is sort of try and characterise and remember, because I've got this theory that we're in the business of forgetting of where we were, and it's very important to try and remember that in order to try and assess the characteristics of that change and what it's meant for workplaces and where we're headed now. So there's a couple of questions I want you to think about, and we'll leave the house lights up. We've got people with microphones. There you go. Give them a wave. You've got a microphone. I've got a microphone. Apparently by the end of this I will be able to touch my toes because I'll be running up and down the stairs. That's cool. I want you to think about the questions about, share your observations with us about the last few years and how it's impacted people in work and community. So what do you reckon's happened? And then then have we caught up in workplaces? Do we understand the changes that have been made? Do workplaces reflect what we understand in community as well as stigma? So think about those three things. What are your observations about what's gone on? And do we have a handle on that in workplaces, and has that had an impact on stigma? So I'm going to start by talking to these guys, and I'd really like you to jump in with any questions and comments around those issues quite quickly after our initial 10 minutes. Shane, I'm going to start with you because you're always at the pointy end when the mice roll in or the floodwaters rise or those weird fires that no one's ever seen before start happening. What do you think has happened since, like, winter 2019 in this country?
So look, the last few years have just been unparalleled in so many ways. Obviously, given my background, I've got a lens that looks at New South Wales, but the narrative can be extrapolated out across the nation in many ways. And whilst I focus very much on the build-up and the duration of the 2019-20 fire season, which was unprecedented in so many ways, its scale, its devastation, the destruction, the displacement of people, and indeed the deadly consequences. We've never seen a fire season like it in the state's history. And what I mean by that is, a lot of people are unhappy that I was using the word unprecedented, but I'm a simple fellow, and if I haven't seen it before and we haven't experienced it before, there is no precedent. If you look back through our history, our most intense fire seasons were typically 2 to 3 weeks, and then we get a reprieve in weather, and then you go through another cycle or what have you. Well, the season of 1920 went for 160 consecutive days of high-intensity fire activity and over 200 consecutive days of declared bushfire emergencies, 2,500 homes just under lost, 26 lives lost, including 7 firefighters. The toll was enormous. Fire behaviour like we've never seen before, exceeding convention at 2, 3 and 4 in the morning, not at 2, 3 and 4 in the afternoon as would normally be the case. I won't use the phrase black summer bushfires. It does a disservice to so many communities that were being impacted and devastated during winter and spring. we were averaging over 1,000 fires a month during winter up in northern New South Wales. And it spread from the Queensland border ultimately to the Victorian border, 5.5 million hectares consumed across our forested country. But the precursor to the fires was one of the worst droughts we've seen in centuries. We had communities on their knees with drought, rural and regional New South Wales, but much further afield across the country. That provided the precursor to the worst ever bushfire season. When the weather finally broke in February of 2020, it broke all right, and we saw extraordinary rainfall, extraordinary storm and wet weather events across a very denuded landscape from drought and from fire. We saw considerable landslides, erosion, damage and flooding across a lot of communities that had already been through drought, that had just been through the worst ever bushfire season, and now they're experiencing these storms and floods. By the time we moved out of February 20, March and April, we were all living the onset of COVID-19. Borders closing, restrictions, conditions, massive disruption and displacement to how we lived and how we worked and how we operated as individuals and as communities. That took us through to the end of 2020. None of us liked 2020. We were looking forward to 21 to being a better year. And when we turned the corner into 2021 in New South Wales, we saw a significant onset of East Coast low activity rainfall events, massive flooding events through the Greater Sydney region, through the Hawkesbury Nepean, the mid-coast of New South Wales, the worst floods they've had on record up there in some of their areas like Port Macquarie, Laurieton, Taree, Kempsey, those sorts of mid-coast areas. Then we went through that in March of 21. I said 2,500 homes lost in the bushfires, 2,400 odd. We had 1,200 homes uninhabitable following the floods of 21. We then went into the middle of the year and we had the Delta variant of COVID, and that brought with it the most extraordinary restrictions and implications that we'd ever experienced. And whilst it was concentrated in Sydney and focus LGAs in the Sydney region, it extended right across the far reaches of the state and elsewhere into some of our more remote, isolated communities and all the challenges that came with the COVID Delta variant. A lot of people didn't realise, but by the time we also hit the end of 21, in New South Wales, we had 75 local government areas declared natural disasters from storms and floods, particularly those that were occurring west of the Great Dividing Range, but also moving across the range and out to some of the coastal areas. So the end of 21, 75 LGAs declared natural disasters, and as we turned into the 22, as we've seen during February and March of this year, record-breaking storms and flood events, particularly up in the northern rivers, but almost 12 months to the day, the Hawkesbury Nepean Valley system all went underwater again. Only it was a metre higher in many areas, causing further damage and further reach. And the displacement through this record-breaking flood by many metres up in the northern rivers has resulted in more than 4,000 homes that are uninhabitable, and we've got an extraordinary concentration across the whole northern rivers footprint, as well as Hawkesbury Nepean and places in between, significant displacement and disruption. So when we think about, and let's throw in a mouse plague in there as well. So the rains brought about pretty good conditions for agricultural production in that intervening period across the state, but so too did it bring the mice, and the mouse plagues were some of the worst we've seen in decades. So when you think about communities, when you think about organisations, when you think about families and businesses and workplaces, we've never seen a period of time with so many significant and consecutive disasters in a short period of time. For many communities, that handful that I just talked about, they've experienced 3 or 4 of them consecutively over the last couple of years. But the one thing that we've all been implicated in and all been affected by, didn't matter who you are, where you are, what you are in society, we've all had extraordinary challenges as a result of COVID. And whilst I look at that through a negative lens, happy to talk with Christine a little while, there's also some pretty significant silver linings out of that period as well. So it's been a very difficult period.
No wonder we want to forget, yeah? Christine, thinking about the mental health implications, particularly what resonated there was that sense of, remember at the end of 2020, where we actually thought that we were going to go back to normal, right? Back. Things were going to be as they were somehow. Not that for a lot of people that was particularly good. And this is part of this notion that we talked about in our pre-briefing of liminal time. So liminal time is like the time between times where you don't, one thing has ended but the next thing hasn't yet begun, and we were all kind of holding on for the next thing to begin and we didn't know the shape of it. So an example of liminal time would be between Christmas and New Year, where you never know what day it is and are the bins going out, and you forget to put the bins out, and there's a lot of prawn heads, it's a disaster. But, you know, you're not quite sure of the space of time, and our relationship with time has all got messed up, hasn't it? Did that happen last week, or did it happen 3 months ago, or was that 2018 that happened? I don't know, sometime. Talk to me about what you think have been the mental health implications of this for the whole of the community, as Shane is saying, because this has been something that has affected the whole of our society.
And look, I think I'll pick up on that point you just made there, that this has affected all of us. I can remember, and let me just do a little bit of a time walk myself, going back into 2019, and we'll come back to answering your question, Ellen. And in the commission, we decided we were going to go out and visit a lot of communities across Australia. And we were particularly interested in asking the question, what is the biggest barrier to seeking help for mental health, or if you're at risk of suicide? And in nearly every community, I think it was only 1 or 2 out of 28 communities, the primary answer was stigma and discrimination. I can't talk about it. I will be mistreated if I talk about my mental health. Then we go into, just as Shane has outlined for us, all of the things that happened, and that was coming off the back of the drought. We go into the bushfires. We then go into COVID. We then go into all of the other natural calamities. And the one consistent thing that has happened over all of this, Ellen, is that we now all realise that in this earth suit that we actually have our physical health but also our mental health. And I think it would be fair to say there's probably not one person living in Australia who hasn't had an impact on how they're feeling, on how they feel they're coping, on how they're reacting to life, on our mental health as a result of it. So I think generally that's been a big impact. I think another thing that we saw happen as we transitioned from 2019 into 2020, the back end of the droughts and the bushfires, what we consistently were hearing was, gosh, we needed our people, we needed our communities. I think, in fact, every rescue package or idea that we had back in January of 2020 was, how do we build up communities? Then, a matter of weeks later, we hit March and we're suddenly told, stay away. Yeah. Stay away. Close the doors. Lock yourself down. Be frightened of each other. And I think that was a very, very strong message that came through 2019, 2020. In the mental health world, we were so concerned by it that when this concept of social distancing started, we said, please can we talk about physical distancing with social connection? And it was a very strong counter movement that we tried to push. Now, the interesting other thing that's happened around the mental health space is that concept of needing each other, of reminding ourselves, don't be so frightened, lean into each other, has, I actually think, spawned a new awareness of just how important for our mental health and well-being our connecting with each other is. And so we've seen some interesting things happen again with mental health, without a shadow of a doubt. We saw highly elevated levels of psychological distress, highly elevated levels of depression, anxiety, fear, and what that meant for people. We also saw people coping in many different ways, coming up with new ideas, but then come back to your liminal time. We got to December in 2020, and how many people like me were sitting there on New Year's Eve going, oh, thank God, we're getting through it. No, we weren't. No, we weren't. We actually had worse to come when it came to COVID. And I think what really happened around that time, it kind of was starting to happen at the back end of 2020 when in Victoria it was getting really bad again. And then for the rest of us, when it went into 2021, we haven't aced this. We haven't got through it. So I think a new element of fear and uncertainty started to come through. Then, as you've reminded us, Shane, you couple that with all of the natural calamities that were happening. And so we went into 2021, and what we saw in 2021 was we just did not even have that base of resilience to come from. And a lot of 2021 was about how can we actually just keep ourselves going? How can we actually get through this? So I think there's been an enormous impact on our mental health and wellbeing. The silver lining, and I do believe in silver linings, is that we have all realised that our mental health can be impacted. We've also, I think, realised, Ellen, that it does make a difference if you reach out for help. And so that's something that's become more normalised.
Can I, anybody having some thoughts about their perceptions of what's happened in the last little while, but also bringing it back to the world of work where you all work?
Can I just share a story picking up on Christine's
Just
comment
and
there?
give me a wave if you want to jump in terms of how it has affected perceptions of mental health in workplaces and the idea around stigma. So I want you to all have a bit of a think about it. Shane, you go with your question.
And it really ties in with exactly what you just said, Ellen, and the point that Christine made very neatly there. In the last couple of years, one of the most troubling conversations I had was in correlation with an anniversary marker for the loss of some of our firefighters. I was talking to an old colleague on the way home one night in the car, and it was late at night, and we were chatting, and it was an emotional conversation reflecting on the enormity of the fire season, the sacrifice, the loss, the survivors and the kids and all those sorts of things. And to get to the point, I said to my colleague, "Are you still getting that support and help?" And he said, "Yeah, I am." I said, "Is it helping?" He said, "Absolutely it is." He said, "It's really helping me out." I said, "I'm really proud of you." I'm truncating the conversation. I said, "I'm really proud of you, keep going." And he said, "No, thanks, boss." I said, "How's it actually helping you?" And he said, "Well, I didn't realise how much I was shutting out my wife. She knew I wasn't processing things very well and wanted to connect, but I just wouldn't let her in." He said, "I realised I wasn't being the best father that I know I can be to my two daughters." And he said, "And I also realised in working with the support and assistance that I wasn't making the necessary and best decisions I knew I was capable of and should be making at work with the team and the volunteers." And I said, "Okay." I said, "So is it helping you get through?" And he said, "Absolutely it is." I said, "You're going to keep going?" He said, "Yes, I am." I said, "Fantastic, really proud, talk soon." And he said, "Before you go, Shane, can you promise me something?" I said, "What's that?" He said, "Can you promise me you won't tell anybody?"
Wow.
I said, "Promise me I won't tell anyone what?" And he said, "I don't want you to tell anybody that I'm getting help." And I said, "You've got to be flipping kidding." I didn't say flipping. I said, "After everything we've just talked about, what's the problem?" And he said, "Well, I just don't want people to know." I said, "Why? We've promoted the idea of reaching out, talking up and speaking for decades now that I've seen us grow and evolve in fire and emergency services." I said, "What's the problem?" And he said, "I just don't want to be judged. I don't want people to judge me. I don't want them to think that I'm not coping. I don't want them to think that I'm not strong. I don't want them to think that I'm not like others that I can see walking around the workplace and getting on with life. And most importantly, I don't want them to think that I can't come back to work and be capable of doing what I love doing, because I know through the support and assistance that it's a key part of me processing and understanding and healing as a result of what we've experienced." And I said, "You really give me the irrits," and I didn't say irrits. I said, "I promise you I won't share the story." So I only promised him partially, because I've shared that story every forum and every
Never
opportunity
tell
I
Shane
go.
anything that you don't
But
want.
the only
800 other
promise I
people that-
kept was I never said who it was. And the
Yeah.
frightening part about that is when I've been to fire and emergency forums and shared that same story in the last 12 or 18 months or so, I've had people come up to me afterwards and thank me for not disclosing who they are. And I need to point out that it wasn't the conversation with them.
Yeah.
That's sad. It's a real reality. And as leaders at all levels, in whatever organisation, we've got to set the example, destigmatise, show that it's okay to be vulnerable. It's okay if you care about what you're doing, if you're connected and you're uncertain about certain things, then speak up with one another and set the example and start destigmatising, this challenge that we've got, which is unfortunately still permeating some of those organisations that have invested decades in saying we need to look out for each other.
Wow. Here's a question up here or a comment.
Hi, I'm Melinda Brady. I'm from the ANU, and I just had a question, I think, about exhaustion in this context. I think our community and that way, awesome, amateur.
I can hear. Sorry, again.
I think our community is sort of a planet, and certainly our community as a workforce at ANU, the silver lining has been this incredible increase in literacy around mental health and understanding of the importance of having those conversations and changing our behaviours and the way we do things to support mental health. However, as someone who's trying to help everyone do that, we're dealing with a group of people in our workplace who are completely exhausted, genuinely exhausted, and I think across our community, the fatigue that has come from this, I heard crisis layering being a wonderful term of just one thing after another. So my question really is, how do we help introduce these conversations? How do we support people to make the changes that they need, which requires creativity and energy, when they are already in a state of, capital B, burnout, or that exhaustion that people are feeling after all of these events?
Brilliant question. Brilliant. Ellen, do you want me to have a go at answering that one? The number one thing that we do is acknowledge it. Is absolutely acknowledge it and to legitimise it. And can I ask anybody here who is any form of at a management level, or in fact I guess at any level in work, have the conversations but really legitimise it. Because fatigue, and we actually talked about pandemic fatigue last year, is real. Now we get this concept with our physical health, we get it. For any of us who have had to go through the ordeals of cancer treatment, etc., we know the impact it has on our bodies, we accommodate it, and we make time for it. We as a nation, as a community, as workplaces, must deal with the reality of actually how we are, not what we would aspire to be. And nobody but nobody could have gone through the last few years and done it in a context where it wasn't just happening in Australia. This has been an international thing. Yep. So we've actually had a whole realignment of our geographic political kind of alignment. The reality is we're exhausted. What do we do about it? We acknowledge it. We realise we need to actually make time to accommodate it physically and emotionally and mentally. And that may mean resetting expectations of what we actually can do. We also need to not trivialise the fact that to overcome burnout, to overcome exhaustion, you need to build in rebalance. We think it's soft and fudgy, doing things that actually give us creativity, give us a sense of happiness. It's not soft and fudgy. It's actually a critical way of replenishing our reserves so that we can go forward. And I think the other thing we do is to realise that this is a critical part of healing and moving forward. There is a great deal that all of us are going to take forward that is going to be of enormous benefit, not only to ourselves individually, but I think collectively in society and in communities and in organisations. But we need time for that to emerge. So I think it's making space for it. It's proactively building in things that will replenish us. Most importantly, in workplaces, it is resetting expectations, and it is gradually supporting each other to move forward. So I know that sounds like, oh gosh, that's going to take time, but it will. Let us heal. Let us heal, let us rebirth, and then wow, what can the future actually bring for us?
That's an interesting idea too, healing. And I think everybody was nodding quietly at the exhaustion line. Even just, you get COVID and 7 days later you're supposed to be right, whereas 3 weeks later you're thinking, can I nip down to the car park and have a little doze in the I-30, Maybe that's just me. Up the back.
And me.
Good morning, my name's Jordan Cogan, I'm from the Air Force. Firstly, I feel very nervous asking a question in front of an audience like this with people who are all experts, and I certainly am not, so apologies if this sounds a little bit clunky. My experience coming back from 2 years of working from home and struggling through natural disasters and other things, I've been surprised at how similar my workplace is and how all our workplaces are structurally and practically. Essentially, we've come back to work and we're doing exactly And what I'm finding now in this new role is that there are people who really are suffering and who are now taking this time off to recover and suffering psychological injuries and poor mental health. And so I guess my question is two parts. Firstly, how can we learn from the experience of other people to make changes to improve our workplaces and the way we support our people? And what can we do differently as an organisation, as leaders in the organisation, to ensure that we are setting the right conditions for people to be able to come back to work in this new normal and work effectively and be safe?
Shane, Matt, I think it's an excellent question. You know, institutional change lags community change. And, you know, there were a lot of people during the pandemic when there were, you know, official failures, right, around sourcing vaccines, sourcing rats and all the rest of it, who would say, and they weren't being flippant, you know, if only we could get the CWA of New South Wales involved, if only we could get Balmain District Footy Club, if only we could get the, what was the name of the basketball that Dion was talking about?
Warriors.
Like the Warriors. We just get things done in community, don't we? There's just, it's quick, there's no meetings, there's no power struggle, we just get stuff done, right? And yet we're all, you know, quietly talking about it, aren't we? The institutional stuff is moving much more slowly, the notion that we're going back to normal, whereas I think in community we understand we're going forward to something else. Talk to me a bit about that, Shane, because you have worked both as a community leader and now you're right in the heart of bureaucracy, right?
And picking up on the question, I tell you what I have learnt a lot about in the last couple of years. I've learnt what resilience is not, and I've learnt in taking on this role and leading an organisation called Resilience. I remember talking to the Premier and the head of the public service at the time. I said, what the bloody hell's resilience? No one's going to connect with what that even means. But I can honestly say, in my lifetime, I don't recall the word resilience being used as much as it has been in the last 2 years. And it's not just because I'm part of an organisation called Resilience. I've been really attuned to this narrative. But what I'm convinced resilience is not is what you find in simple definitions. Resilience typically will say, in dictionary definitions, the ability to bounce back to normal after displacement or disruption, something like that, right? Words of that effect. Well, I call BS on that because, as the question just said, what is normal anyway, and why would anyone want to go back to that state and be just as vulnerable or susceptible to the displacement or disruption again? So through talking to a lot of people, listening to a lot of people, and reading a bit, I generally believe that resilience is about learning through lived experiences, learning through life experiences, and coming out the other side better, stronger, and wiser result of that experience, better able to anticipate and prepare ourselves for the next challenge and the next displacement and the next disruption. I think it's Einstein's definition that says, you know, the definition of stupidity is doing the same thing over and over again, expecting a different result. We know, particularly through workplaces and the consecutive disasters and now COVID, I see the silver linings. I never knew what Teams and Zoom was 2 years ago, and I'm bloody sick of it already. But the reality is it's been a blessing, and particularly at an organisational level in my experience, in the public sector and the private sector. Because what it did, it caused the newest of employees, those on the workshop floors, right through to senior leaders and executive members, to be suddenly joined up together, albeit virtually, when most of the workforce will often only hear from their executive via emails or memos or something like that about what's going on. But when they were actually joined up and sharing their own personal experiences, in leadership, in crisis and uncertainty, the criticality of leadership is to build confidence and trust. So you do that when you relate and connect, in my view. So when we're doing all these Zoom meetings and these team meetings, and people are genuinely anxious and worried about where they are, what they're doing, when they can see their peers, when they can see their leaders doing exactly the same thing, dogs and kids on the screen interrupting them at home, not knowing where to from here because we don't have all the answers. But when people open up and share and be vulnerable and acknowledge the human element of what we're all going through, no matter your role or status in an organisation or in society, we get buy-in. If people can relate and empathise with what's going on at both levels, then people feel part of something. And with the displacement that's occurred, we know the research is showing, for a lot of workplaces, people want, the pendulum swung all the way that we're all working from home. And the novelty's worn off for most people that they don't want to keep working from home all the time, but they don't want to swing all the way back to where they were and be stuck back in the office all the time as well. We need a better balance. So how we're accommodating that, and organisations need to be able to work out how can they properly instill legitimate, meaningful workplace flexibility to get life balance issues right, because I think one of the key attributes of COVID is it reminded us that disasters and disruption don't happen to someone else and to in some other location. We are all vulnerable and susceptible to things that are beyond our control.
Christine, you also have to talk here about not everybody was working from home. So we've begun to think very hard about what we value, not only what we value, I'm waving at the speaker, there we are, what we value at work and whether it's in tune with our values, but how we value work. And I noticed that the Fair Work Commission under Labor apparently needs a bunch of committees and expert panels, which I thought the Fair Work Commission was supposed to be an expert panel, to advise them on the value of caring work. That it's not something women do because they have ovaries. It is work that has value, right? And so we're starting to rethink all of that. Now, I know you have some statistics sitting there about the extent to which organisations and leaderships are lagging on their understanding of the mental health burden and of these sorts of cultural changes about what we value. Just tell us about that.
Look, and thank you, Ellen, because it is actually really sobering. So if we look at work, and you're absolutely right, work it's a critical part of us. We have this phrase in the Commission, we talk about the value of having what we call a contributing life. What's that? Basically means that all of us want to be able to contribute in some way. We want to link in with our unique attributes and be able to put them out there. And so for a lot of people, work is incredibly important. But it also can have a really negative impact on us. So work is important. The type of work we do and how we do it is important. It can be a really protective factor for our mental health, or it can negatively impact us. And then, on top of that, it happens in workplaces. And workplaces can be in and of themselves either positive or negative. So, just a couple of stats. 32% of Australians have said in the last 12 months that work has had a negative impact on their mental health, their work, what you're saying. So if work is not constructed in the right way, it's not designed in a way that works for them, that's had a negative impact on them. When we look at what happens in the workplaces, it actually gets worse. And I think I do actually have to put this before all of us, because we have this reality, as Shane and I have been talking about, where we can all now recognise we all are capable of having our mental health negatively impacted. We are as likely to be as mentally unwell as we are physically unwell. Hello, we're humans. And yet, there's consequences. So, a couple of stats on that one. 4 out of 10 Australians who said over the last year that I had a negative impact on my mental health, I've been mentally unwell, only 4 out of 10 were prepared to even talk about it in their workplace. So 60% were like your mate, they were not prepared to talk about it in the workplace. Of those who talked about it in the workplace, they were twice as likely, they reported, to actually be discriminated against and to be harassed. Now, we all think we don't discriminate. We understand each other's mental health. We understand each other's mental well-being. But actually, if you dig beneath it, if you scrape the surface, do we? Do we carry opinions and attitudes? Do our work structures actually mean that if we disclose we are mentally unwell, there are attitudes and things that happen to us which are actually negative? Unfortunately, that is the case. And then when you take it out for those of us who are at a more senior executive level to employees, 80% of us senior executives actually say, yeah, we've got workplaces that are mentally healthy and well. They're great for people. We look after our people well. 80%. Go and ask employees and less than 50% will agree with that. Then also look at our own mental well-being. Those of us who are more senior, about 61, 62% of us, so we're in the highest category of saying we have really good mental health. I wonder if that's got something to do with the fact we might have a little bit more control. But when it comes to actually our employees, only about 33% will say that they've got really good mental health. So there is something happening in workplaces. We do have to call it out, and I think you made a really, really strong point that the community leads on our institutions. It does, and that's a reality again that we need to call out. And each and every one of us can actually impact in our workplaces, and we still have a lot to do. Wish we didn't, but we do.
And
somebody up there.
I think before the question, picking up on Christine, I don't have that authoritative knowledge like you've got, but an anecdote that I would share is that in the last couple of years, a lot of workplaces and a lot of people in New South Wales impacted and affected have been farmers and landholders that run and operate their own businesses on properties. The families and loved ones, the neighbours that will come to me and come to members of my team saying, can someone please get up and speak to Bill and Mary, whatever it is. We're really worried about them. They won't put their hand up for any assistance. They wander around their property or business working out how they're going to put things back together. But they don't know how they're going to put things back together. They're too proud to get help and don't even contemplate getting someone up there to talk to them about mental health and well-being. They don't need a bloody shrink reading their mind, blah, blah, blah. In this latest flood event, the extraordinary circumstances of North Coast New South Wales and Northern Rivers, through our primary industry presentations for support, 40% of the presentations that we're receiving through the latest flood event are farmers and landholders that we've never seen coming forward for assistance before, even though in the last couple of years they've been through the worst drought in their living memory. They've been through the fires, they've been through storms and floods, they've been through 2 big phases of COVID, but this is the one that they concede they just can't absorb anymore, they just cannot get through anymore. And when it comes back to those people asking us to go and talk to landholders, they come from a really strong place that says we don't want them giving up hope. We don't want them finding the task of rebuilding, recovering and healing so overwhelming that they opt out of life. So it's actually a very real, it comes from a very deep and sincere position, and it's not just the conventional workplace where we've got this extraordinary challenge playing out when you look at a lot of the farmers and primary producers around my area of New South Wales, for example.
Another question up here, and I'll come over here.
Looks a lady just over here too.
Good
He's got the
morning.
mic.
My name is Dean and I work for an organisation whose headquarters is majority of it is in Canberra. We're a group of about 70 who are outposted to Melbourne, and in March 2020 I think it was, most of the workforce quickly migrated to working from home. Did that for the best part of 2 years, and as far as I'm aware we didn't drop one ball in terms of our work output, which I think was a fantastic effort. The workforce emerged from that in about December last year, roughly. And then in April, May, we received an email from our boss, who is in Canberra, advising that the organisation's structure was being looked at. And whilst he stressed that no decisions had been made, there was a very heavy inference that the Melbourne workforce could quite possibly be required to work in Canberra at some stage with, again, no time frame provided. That's provided quite a question mark for many of the employees, not only about their future employability, but their ability to support their families, pay bills. And I'm just wondering, whilst I find that sort of behaviour quite unconscionable, it is a reality, and whilst no decision has been made, I'm wondering how we deal with that as a workforce, because we've got a workforce that some coped okay during COVID, but many didn't. And to be quite frank, it feels like a significant kick in the guts from an organisation who professes to create the impression that people are its best asset.
Yeah. And what I'm going to do is go, I'm not ignoring your question, I'm just going to get that microphone passed across to this lady here, and she can say what she needs to say, just pass it along take one, pass the rest along. Member Primary School. Yeah.
The music stops, I get it.
That's it.
Everybody. So my name's Nikki Bridge. I'm from Connect, a national rehab provider. So we've been holding the hope of people recovering from injury, illness and disease for the last 25 years. My question's about the wonderful collectiveness as Australians that we do really well. As you say, Shane, in floods, in fires, and in COVID, we did a lot of things we didn't want to do as individuals, but we did it for the best of everybody else. So I'm really interested in your thoughts on how we can shift that sense to workplaces.
Yeah.
Because what I see is when people have injury or disease, and particularly mental health conditions, it actually becomes an individual problem and an individual responsibility. So have you got some thoughts on how we can share that love?
I think I do, but Ellen, there was a lady there that had a hand up a few questions ago that we should just get her comment as well before
Sure. That'll be me. I put my back out on top of everything else. It's just, middle age.
Thank you. My name's Rebecca and my background is in child protection. And I guess my question is, or my observation, is that when we watch these frontline workers, we all have the background in psychology or social work. But what we've seen as a kind of after effect is that these people who are so trained in trauma, who are so trained in being able to help other people, it's actually, they're being treated a lot differently and in fact being shamed a lot more. This is what you expected to go when you went into this role, suck it up. And I also worry about the shame that people experience, similar to what you were talking about with the fire service. They do make decisions about whether or not to remove a child from a family or whether a parent is fit to have their children in their care. And so for them to show any form of vulnerability through this is even harder for them, because if they suddenly come out and say, I'm struggling mentally, then they're questioned on their whole ability to do their job or about the well-being of a child. And so I guess my question is, how do we break down that or address that specific needs for frontline workers who aren't really allowed the same, vulnerability as other services?
And that is, if I can just comment on that one, Shane, that is such a big issue, and we'll come back to the other two questions, because it also faces our medical professions, and how frequently, too frequently, heartbreakingly frequently, we hear about medical and other health professionals who push themselves into places that they should not be going into for their own well-being because of the consequences of disclosing. And I think that is the challenge.
Okay, I'm just going to interrupt because we've got 2 minutes left. I'm going to give you a minute each. Maybe start with you. Christine, the first comment, that's about respect, right? It's about, you were talking about control and your sense of control is critical, right? And that's about sharing power. That's about the way institutions work to share power. Those people aren't worried when they say you've got to move because they know what they're going to bloody do, don't they? They've made those decisions because they saw it coming. They had share of information, they had share of power. And here's an issue that we're coming up with again and again, is something's changing in our community. We saw it with the federal election too, not in terms of red versus blue, but all over. It's a question of empathy. We're being asked about empathy. We're being asked about respect. So your comments on that, and then we'll conclude with Shane. Just a minute each,
Just a minute each on empathy, respect, and actually having a voice. And I think that is it. I think we actually now need to say, I actually do have a voice. I do have an opinion. I am somebody that contributes to the output of this workplace. Please hear me. And I do have mental health needs. I am vulnerable. It doesn't mean I'm permanently impaired. Just like when I get the flu, I need to rest to get over it. When I am mentally exhausted or stretched or burnt out, I just need to get over it. So I think it's finding a voice, having a voice, and being prepared to say it. And let's go back to our wonderful previous speaker, being brave enough to do it.
For me, picking up on the three themes there, it comes down to fundamental leadership attributes at all levels. I think they centre around authenticity, they centre around humility and empathy, they centre around the criticality of making decisions and explaining the why to those decisions. It comes down to communicating, and the final thing is it comes down to care, and through care means presence and legitimately showing vulnerability is okay in a workplace. Authenticity, and I've got an old crude phrase, if we've been dealt or given a dog poop sandwich, we can't cover it in hundreds and thousands and convince people it's fairy bread. They will work it out really quickly, especially if you're asking people to eat it. They will smell it and taste it really quickly. So no matter the challenge, the more authentic we can be with ourselves and with our teams, the better chance we've got of getting legitimate engagement and building trust and confidence. If we exaggerate the situation, we lose them. If we understate the situation and pretend it ain't happening, we lose them. So authenticity is critical. The more we understand our teams and our audience, we can relate. One of the biggest demotivators in the workplace is the indecision of management. People are happy with decisions they don't like, that are explained and understood why we're going down a certain path. And if we genuinely care and we connect with our organisations and we've got that humility, I believe that will come through in communications. And when leaders properly communicate, they talk about the latest advice and understanding and the things they don't know. They talk about what we're doing and why we're doing it. They talk about what we're not doing and why we can't or won't be doing that. And most importantly, they talk about what they want everyone else to do to be part of that equation. And I think if we mix them up in times of uncertainty or crisis or indeed routine, BAU of organisations, we hopefully engender that trust and confidence. But it starts with example setting, and it starts with defluffing a lot of the narrative, in my view.
Wonderful conclusion. Please thank Christine and Shane.